Hello friends, welcome to my channel Vasu Medical Diary. Today we are going to see third chapter of NABH 5th edition, which is MOM, Management of Medications. In this chapter we have 11 standards and 76 objective elements. We'll see one by one. First standard, pharmacy services and usage of medications is done safely. Pharmacy services and medications usage are implemented following written guidelines. There should be a separate written guidelines and SOP for pharmacy services. A multidisciplinary committee guides the formulation and implementation of pharmacy services and medication usage. There should be a separate pharmacotherapeutic committee who decides about the pharmacy purchase and formulary maintenance, as well as the antibiotic stewardship and so on. There is a mechanism in place to facilitate the multidisciplinary committee to monitor literature's reviews and best practices information on medication management and use of the information to update medication management process. There is a procedure to obtain medication when the pharmacy is closed. So there may be a hospital, they are very small hospital, only in the morning time pharmacy is available. So in case of emergency in the night time, how the emergency team will approach a pharmacy, how the medicine is obtained, there should be a written policy. The organization has a mechanism to inform relevant staff of key changes in pharmacy services and medication usage to ensure uninterrupted and safe care. MOM 2. The organization develops, updates and implements a hospital formulary. A list of medication appropriate for the patients and as per the scope of organization's clinical services is developed collaboratively by the multidisciplinary committee. So hospital formulary is nothing but there should be a book. Formulary is usually, it will have all the type of medicine which is used inside the hospital. So if in case of any addition or deletion, pharmacotherapeutic committee will decide. None of the medicine will be entertained from outside which is not inside the hospital formulary list. The list of formulary should be always updated with the help of pharmacotherapeutic committee. So the list is reviewed and updated collaboratively by the multidisciplinary committee at least annually. The current formulary is available for clinicians to refer to. For example, whoever is practicing OP consultation in that hospital, they should be aware of this formulary. The clinicians adhere to the current formulary and the organization adheres to procedures for the acquisition of formulary medications. For example, if at all a private practitioner is practicing OP inside this hospital, they have to follow this current particular formulary. They cannot write separately on their own the medications. The organization adheres to the procedure for the acquisition of formulary medications. The organization adheres to the procedure to obtain the medications not listed in the formulary. So there should be a policy to obtain medication which is not there in the medication formulary also. MOM 3. Medications are stored appropriately and are available where required. Medications are stored in a clean, safe, secured environment and incorporating the manufacturer recommendation. So all the medicines wherever you are storing, they should follow manufacturer's recommendation by the staff. Sound inventory control practices guide storage of the medications throughout the organization. So the proper temperature, safety, cleanliness and the storage criteria should be maintained everywhere in the hospital. The organization defines a list of high-risk medications. High-risk medications are stored in areas of the organization where it is clinically necessary only. And high-risk medications including look-alike, sound-alike medications and different concentrations of the same medication are stored physically apart from each other to avoid confusions. The list of emergency medications is defined and stored uniformly. Emergency medications are available all the time and they are replenished promptly when they are used. MOM 4. Medications are prescribed safely and rationally. Medication prescription is in consonance with the good practices and guidelines for the rational prescription of the medications. The organization adheres to the determined minimum requirement of a prescription. Drug allergies and previous adverse drug reactions are ascertained before prescribing. The organization has a mechanism to assist the clinician in prescribing appropriate medication. Implementation of verbal orders ensure safe medication management practices. So there should be a separate policy while giving a verbal order. Example, whoever is giving a verbal order, next day they have to come and countersign, and read back policy will be followed. Capital letter they have to write down and read back to the consultants, all those things. Audit of medication orders prescription is carried out to check for safe and rational prescription of medications. Corrective and or preventive action is taken based on the audit where appropriate. Preventive action is taken based on the appropriate audit where appropriate. Reconciliation of medications occurs at transition point of patient care. MOM 5. Medications orders are written in a uniform manner. The organization ensures that only authorized personnel write orders, and the medication orders are written in a uniform location in the medical orders, which also reflects the patient's name and unique identification number. Medication orders are legible, dated, timed and signed. Medication orders contain the name of the medicine, route of the administration, strength to be administered, and frequency, time of administration. MOM 6. Medications are dispensed in a safe manner. Dispensing of medications is done safely. Medication recalls are handled effectively. Near expiry medications are handled effectively. For example, inside the pharmacy, the near expiry medications should be arranged in first out basis. Dispensed medications are labeled. High risk medications ordered are verified before dispensing. Return of medications to the pharmacy is addressed. MOM 7. Medications are administered safely. Medications are administered by those who are permitted by the law to do so. Only a licensed nurse will administer medicine. Prepared medication is labeled before preparation of a second drug. For example, if the nurse is going to prepare 2-3 drugs at a time, after loading a first dose, she has to mention the label in the first medicine and then only prepare the second drug to avoid confusion. The patient is identified before administration. Before administering a medicine, they have to identify properly with the full name and Aadhaar card and date of birth. Medication is verified from the medication order and physically inspected before administration. Strength is verified from the order before administration. The route is verified from the order before administration, whether it is IV, IM or subcutaneous, everything. Timing is verified from the order before administration. Measures to avoid catheter and tubing misconnections during medication administrations are implemented. Medication administration is documented. Measures to govern patients' self-administration of medications are implemented. Measures to govern patients' medications brought from outside the organizations are implemented. MOM 8. Patients are monitored after medication administration. Patients are monitored after medication administration. For example, they have to be observed based on the recommendation of the medicine. Medications are changed where appropriate based on the monitoring. The organization captures near miss, medication error and adverse reaction. So there will be a separate medication nurse or the link nurse who will monitor all the medication errors and report to the quality team. Near miss, medication error and adverse drug reaction are reported within a specified time frame. Near miss, medication error and adverse drug reactions are collected and analyzed for root cause analysis, and corrective and preventive actions are taken based on the analysis. In simple, we can say all the medication administration should follow 10 rights of medication administration. The 10 rights already discussed in our channel previously. I'll give the link below. MOM 9, narcotic drugs and psychotropic substances, chemotherapeutic agents and radioactive agents are used in a safe manner. Narcotic drugs and psychotropic substances, chemotherapeutic agents and radioactive agents are used safely. Narcotic drugs and psychotropic substances, chemotherapeutic agents and radioactive agents are prescribed by the appropriate caregivers. Narcotic drugs and psychotropic substances, chemotherapeutic agents and radioactive agents, drugs are stored securely as per the norms. Chemotherapy and radioactive agents are prepared properly and safely and administered by qualified personnel only. A proper record is kept use of the usage, administration and disposal of narcotic drugs and psychotropic substances, chemotherapeutic agents and radioactive agents. MOM 10. Implantable prostheses and medical devices are used in accordance with laid down criteria. Usage of the implantable prostheses and medical devices is guided by scientific criteria for each item and national international recognized guidelines approvals for such specific items. The organization implements a mechanism for the usage of implantable prostheses and medical devices. Patient and his or her family are counseled for the usage of implantable prostheses and medical advice, including precautions if any. The batch and the serial number of the implantable prostheses and the medical devices are recorded into the patient's medical record, the master logbook and the discharge summary. This is not only for ortho implants, this will also applicable for cardiac stents. Recall of implantable prostheses and medical devices are handled effectively. MOM 11. Medical supplies and consumables are stored appropriately and are available where required. The organization adheres to the defined process for the acquisition of medical supplies and consumables. Medical supplies and consumables are used in a safe manner where appropriate. Medical supplies and consumables are stored in a clean, safe and secure environment and incorporating the manufacturer's recommendation. Sound inventory control practices guide storage of medical supplies and consumables. There is a mechanism in place to verify the condition of medical supplies and consumables. End of chapter 3. Thank you. We'll see in next chapter, that is chapter 4, PRE, Patient Rights and Education.